Good morning. My name is Janice Orga Rodriguez, and I'm a registered nurse. I'm finishing my bachelor's degree in nursing, and I am doing this video because I have a project that I need to do regarding the subject, which is hip fractures. The common population that normally, indeed, is the most vulnerable for these hip fractures is the elderly population. Therefore, I'm gonna answer some questions for this project that would definitely help our elderly population to avoid hip fractures. Okay, so the first question is, what is the community you choose for this project? Where is it located, and what is the issue topic you choose to discuss to teach this community? So falls are very common phenomenon, especially among the elderly. One of the most serious falls injuries is a broken hip. Hip fracture among adults can result in shortened lifespan, reduced independence, immobility, and pain, and blood clots in the lungs and legs. It is very difficult to recover from a hip fracture, and afterward most individuals cannot live on their own, creating dependency. Yearly, approximately 300,000 individuals, those above 65 years old, are hospitalized for hip fractures. According to the CDC in 2019, the 95% of these fractures are caused by usually falling sideways, and the chances of breaking one's hip increase. So as one grows older, this risk increases. Most importantly, the U.S. population is increasingly getting older and exacerbates the situation, as the number of hip fractures is likely to go up. However, falls are preventable and do not have to be an inevitable part of aging. It therefore brings the need to address this gap and reduce the frequency of falls among older adults. So the community that I chose was the community where there's a lot of nursing homes around, which focus on the elderly population, which is the one more at risk regarding hip fractures. It is located throughout the world. We have community nursing homes, affordable nursing home for our patients or elderly population, where they can go and be assisted by our nursing and healthcare professionals. So why did I choose this topic? How is the community you have chosen able to access your information? And for example, will you teach during a visit to the primary healthcare provider? Will you teach them at the hosted event at church? Or will you visit the adult daycare they attend? Will you visit a school? Or will you visit a summer camp? Definitely, I chose this topic because due to the aging population in the United States, both the number and the proportion of people aged 65 years and increasing, it is approximated that those aged 65 and above make up 13% of the population, according to the CDC in 2019. So, according to the CDC, the United States will experience a dramatic change during the next 50 years, becoming a major country in which 1 out of every 5 people would be 65 or older. With people getting older, the aim is to assist individuals remain healthy and maintaining a good level of quality of life throughout their lives. Helping the elderly avoid falls will decrease the causes of hip fractures, which are longer, healthier lives, which are prevalent among the population and will enable them to live longer also and have healthier lives. I aim to develop a project that will help the adults have access to the information about preventing hip fracture. And I will also would love to visit nursing homes, adult daycares, residential care facilities, and offer the information through primary healthcare providers. So I would take pamphlets, I would take posters, and teach them about how to avoid falls, to avoid as well hip fractures. Definitely avoiding falls will help decrease these high numbers of hip fracture. So therefore, avoiding at home, giving clues and ways to avoid at home falls, or in any residential or any place or elderly population is at. We have to avoid the rugs. We need to have to keep and maintain lining for them so that they can see where they're stepping. We need to make sure that they use non-slippery shoes. So those things are things that I would like to encourage our elderly population to do, and their family members to insist in them taking more care and being more aware of these things to do to avoid falls and hip fractures. So the next question is, what is the intervention you perform to fill this need in your population? Was it a PowerPoint, a demonstration, or a video? Okay, so the best intervention that will be used to offer the information and address this concern is with a PowerPoint, which is what I use for this project. It is because a PowerPoint is a quick and easy way to organize ideas. It has short information. The elderly population, sometimes they get frustrated and they feel like they don't have time to listen to a huge book or a huge video or something that makes it long, because they feel that they want to get the information in a short content. So definitely using a PowerPoint where we summarize most of the content and put in together the most important things to avoid falls and hip fractures helps them achieve this goal of preventing and getting a hip fracture. Okay, so it is because PowerPoint is quick and easy, as I said. It's a way to organize ideas and information, and this tool allows the use of audio as well. We can use video in between and images, making it more interesting and increasing the audience to focus. The project will also utilize social media, like including Twitter, because even though we don't think about it, like there's a lot of elderly population that they do use Facebook, they do use Instagram, so they can check these social medias as well to inform themselves of how to avoid falls and prevent hip fractures. Okay, so the social media include, like I said, Twitter, Facebook, and Instagram, so that we can reach a wider audience. Okay, so displaying statistics and hip fractures and the methods that can be used to reduce the cases of the fractures is very important. Okay, so lastly, the last question would be, how would you elevate your intervention? How do you evaluate your intervention was understood or acknowledged by the community? Well, the method used to evaluate if the information has been understood and acknowledged by the society is through surveys. So definitely a set of questions will be formulated with multiple answers to make them simpler and easier to understand and answer. They will be sent to the audience both in the residential care facilities and through social media, to ensure coverage of a wider survey and population, so that most of the age adults get to fill in this survey and we get a better result of how we are doing. After the participants have completed and answering the survey questionnaires, we will evaluate if they understood the information through the scores in the surveys. Depending on the scores, we will analyze the way forward. If they demonstrate performance, the next step will be to promote awareness of the issue through another strategy, and if they are okay, we keep and maintain doing the same the same promotion, the same way of teaching and getting information to